Hello. Good morning and good evening, especially to student nurses and friends out there. We are going to talk about nursing pathophysiology diagram regarding brain tumor. The predisposing factors are reasons that putting brain into high risks of chances in having tumor, while precipitating factors are reasons that can directly cause a brain tumor. But up to this point in time, no known etiology for brain tumor, therefore nothing to discuss on precipitating factors. The first predisposing factor is previous frequent exposure to ionizing radiation like radiation therapy eventually damages the abundant cells found in the central nervous system, which includes the brain and spinal cord. What are the cells? Are that the glial cells. DNAs of glial cells have the capacity to repair the damages caused by ionizing radiation, but in the frequent exposing of glial cells to harmful radiation is resulted to defect DNA. The second predisposing factor is hereditary condition. Every cell has two copies of genes. One gene is from the mother and the other one is from the father. The hereditary condition means an acquired defect of genes and it could be dominant or recessive. Autosomal dominant disorder is referring to a one gene defect but it can cause inborn damages. Autosomal recessive disorder is pertaining to two genes defect which obviously cause inborn defects. Genes defects are also DNA's defect and alteration in glial cells activity or behaving as mutated glial cells. Third predisposing factor is chemical substances and well known as carcinogenic like smoking cigarette produces thousands of chemicals. The people who works in factory or industrials, gasoline stations or oil company are exposing themselves to chemical substances for long years. The damage caused by chemical substances to DNA of glial cells can be self-repaired, but a frequent DNA damage to continuous exposure of chemicals can lead to glial cell mutants. The fourth predisposing factor is metastasis. It is referring to other cancer that spread to brain which causes brain tumor to develop. An example is breast and lung cancer that spread to the brain via lymphatic system. The mutated glial cells don't die as compared to normal cells that has its own lifespan for new glial cells to be born. The mutated glial cells such as mutated oligodendrocytes, mutated astrocytes, mutated ependymal cells, mutated microglia, mutated Schwann cells, and mutated satellite cells are multiplying uncontrollably until such new growth of tissue becomes tumor. At the same time, angiogenesis is present. This is the developing of new vessels to supply blood and nutrients for tumor to grow more and more. The tumor growth can be found to any areas of central nervous system and derive its name according to involved cell location or parts of central nervous system. The tumor mainly causing compressions, obstructions, and increased cranial pressure are mostly reasons for clinical manifestations. Acoustic neuroma, also known as vestibular schwannoma, affecting the main nerve from inner ear to the brain. The manifestations are impaired hearing and balance. Astrocytoma. The cancer started from astrocytes in the brain and spinal cord which supposedly supporting the nerve cells. The clinical manifestations are impaired transmission of signals, impaired electrical activity, which can cause seizures, headache, body weaknesses. Choroid plexus carcinoma, rare cancerous that occurs mainly in children. It begins near brain tissue that secretes cerebrospinal fluid or CSF. The clinical manifestations, blurred or double vision and other clinical manifestations. Craniopharyngioma, rare, benign tumor, and it begins near the pituitary gland. It affected its ability to produce hormones that controls many body functions. The clinical manifestations are obesity, excessive thirst, and other clinical manifestations. Embryonal tumors, it begins in fetal cell's brain. So, mostly occur in babies and young children. Inborn brain tumor to babies and young children has increased ICP, which makes them irritable, high-pitched cry, or low level of consciousness. Ependymoma. It begins in the ependymal cells that are found in brain and spinal cord that lines the passages of brain ventricles where the CSF nourishes the brain, often common to children. The clinical manifestations are neck pain, impaired balance and walking, tingling sensation, and other clinical manifestations. Glioblastoma, aggressive type. It begins in the astrocytes that supports nerve cells. The clinical manifestations are high ICP, persistent headache, vision problem, and other clinical manifestations. Glioma. Tumor begins at glial cells that surround nerve cells and help them functions. Gliomas are astrocytoma, ependymoma, glioblastoma, and oligodendroglioma. The clinical manifestations are memory loss, irritability or personal changes, impaired balance, and other clinical manifestations. Medulloblastoma, malignant brain tumor, start in cerebellum which involve in muscle coordination, balance, movement, mostly involves children. The clinical manifestations are clumsiness, handwriting problem, and other clinical manifestations. Meningioma, tumor that is in the meninges, the covering or membranes that surrounds the brain and spinal. The clinical manifestations are vision problem, headache, that worsens in the morning, and other clinical manifestations. Oligodendroglioma, that tumor that occur in brain and spinal cord. It begins oligodendrocyte cells that protect nerve cells. It affects at any age but oftentimes with adults. The clinical manifestations are seizures, language difficulty, memory problems, and other clinical manifestations. Pineoblastoma. It is rare, aggressive, begins in pineal gland cells that produce melatonin for natural sleep-wake cycle at any age and common to children and teens. The clinical manifestations are headache, trouble, eye movement trouble, tiredness, and other clinical manifestations. Pituitary tumor, benign tumor in the pituitary gland which affect hormone productions and signs and symptoms hormone-related deficiency. Imbalanced ACTH or adenocorticotropic hormone. The clinical manifestations are fat accumulation around the midsection and upper back of the body, facial roundness, thinning of arms and legs, and other clinical manifestations. Imbalanced growth hormone or GH. The clinical manifestations are coarsened facial feature, enlarged hand and feet, and other clinical manifestations. Imbalanced prolactin. The clinical manifestations are irregular menses, lack of menses, erectile dysfunction and gynecomastia, and other clinical manifestations. Imbalanced TSH or thyroid stimulating hormone. The clinical manifestations are weight loss, rapid and irregular heartbeat, excessive sweating, and other clinical manifestations. Tumor location by lobes are the following. Frontal lobe tumor affected the ability on speech or language, memory, concentration, and other clinical manifestations. Parietal lobe tumor affected the ability on speech, writing, drawing or naming, recognition, and visions. Occipital lobe tumor affected the ability on vision and visual field. Temporal lobe tumor affected the ability on speaking, understanding language, short and long-term memory, and control behavior. The diagnostic tests are CT scan, MRI, skull X-ray, PET scan, biopsy via Berholing, and examine its tumor grading. Grade 1 tumor. Tissue is benign. The cells found in the tumor look nearly like normal brain cells and they grow slowly. Grade 2. The tumor tissue is malignant. The cells found in the tumor look less like normal cells than do the cells in grade 1 tumor. Grade 3. The malignant tissue has cells that look very different from normal cells. The normal cells are actively growing. Grade 4. The malignant tissue has cells that look mostly abnormal and tend to grow quickly. After diagnostic test and tumor grading is the medical diagnosis, that is brain tumor. The medical diagnosis is the main basis of what best management can be provided to the patient with brain tumor. The management is divided into 3. Medical management, surgical management, and nursing management. All these managements are actually considered as palliative or supportive management since survival incidences are few. Just continue watching the video till the end. Appreciate the diagram for brain tumor. Daghang salamat. Signing off, Bongits!